welcome back to This Week in Immigration. I'm Jordan LaPier. This week, a scathing report on this summer's family separations, reports of a tent city for immigrant children, and the administration's proposal to alter the definition of a public charge. All that just ahead. But first, remember, you can subscribe to this podcast on Apple Podcasts, Google Play, Stitcher, or wherever you get your podcasts. And while you're at it, leave a review to help more people find this program. You can also stream This Week in Immigration on our website at bipartisanpolicy.org. And as always, check out bipartisanpolicy.org/immigration for more information on the stories we discuss here on the show. And here with me today, as always, are Theresa Cardinal Brown, Director of Immigration and Cross-Border Policy. Hi, Theresa.
Hi, Jordan.
And Cris Ramón, Policy Analyst. Hi, Cris.
Hey, Jordan. How's it going?
Thanks to you both for being here. Theresa, I'll start with you today. The Homeland Security Department's Inspector General is out with a new report looking at how DHS conducted itself during the family separations crisis earlier this summer. It had precious few good things to say, this report did. But what stood out to you?
A couple of things. The overall impression of this report is that agencies were wholly and completely unprepared to implement this policy. They did not have the resources, they did not have the infrastructure, they did not have the technology to appropriately implement this policy in a way that would not result in the outcomes that we saw. Families being separated, parents not knowing where their children were, the inability to reunite kids or even locate parents and children. All of the consequences we saw, the OIG report confirmed, and it just struck me very much how much these agencies were just unprepared to implement this.
One of the things that came up in the report was that DHS and HHS computer systems weren't talking to each other. And I wonder if you can get to why that is such an important element here.
So you have to understand that when we're talking about children, there has to be a handoff between Customs and Border Protection, the Border Patrol, which initially receives the children, whether they're with the family or not, has to process them in terms of getting their identity, their basic biographic data, taking biometrics of children who are old enough to have biometrics taken, and then getting that information about what's to happen to them for their immigration processing. And then they hand it off to Immigration and Customs Enforcement, who are responsible for transporting those children to the care of Health and Human Services. So there's two handoffs that usually happen, and information has to be handed off from one agency to the other along with that child. And what the problem is that there is no automatic handoff. So the CBP database that this information is entered into is not the same as the ICE database. The ICE database is not the same as the HHS database. There are some, if you will, tunnels between them, so some data can go through, but not everything. For example, when CBP had information about whether or not a child that was to be transferred had been separated from adult, there was a place in their software to indicate that, but that field didn't transfer onto ICE. So ICE didn't know if this was a child who had come unaccompanied or been separated. Eventually, CBP realized that and started putting that information in a text field, but that meant that ICE had to open up every file and look at that text field, and there was no way to automatically search for those children in the ICE database that had been separated. Furthermore, ICE couldn't necessarily transmit that information directly to HHS because their systems didn't talk. So what ended up happening is they would create Word documents that were emailed between the organizations. So you can already tell that this is not systematic, this is not automated, and it's not done in a way that makes tracking possible or even going back to find out what happened before. That's an example of where technology really impedes effective implementation of any policy, much less a policy that you're talking about the lives of children.
The report also got into the length of time for which children were kept in Border Patrol facilities and in holding facilities. Normally there's a rule, I think 3 days, right?
72 hours actually is the rule that no one, not especially children, but no one is supposed to be kept in a Border Patrol facility along the border for more than 72 hours. And that's because they were not designed to hold people for longer periods of time. Don't have appropriate shower facilities, exercise, all of those things that more formalized, longer-term facilities would have. They're simply meant to that time that CBP can collect the data they need and pass it on to another agency. But because of the number of arrivals, because the separation policy increased the number of kids, because there were backlogs in ICE taking the transportation of the kids to HHS. Everything got backed up, and kids were staying in those facilities for much longer than 72 hours. In one report in the Rio Grande Valley sector, over 40% of kids were there more than 72 hours. At least one child was there for 25 days. That's unacceptable under any circumstance.
Theresa, you talk all the time here about needing to balance two interests. On the one hand, maintaining the integrity of our immigration system, and on the other, to maintain and respect the dignity of the people that are in it. What does this report say to you about the government's ability to do both of those things right now?
Well, I would say they failed on both counts. They certainly failed on the dignity of the people in the system by not having appropriate processes and recognizing that these were children put into what are essentially, in many cases, adult systems, and having a plan for how they would reunite them with adults. That system failed them on that count. And in terms of the integrity of the system, this entire effort, if it was meant to deter more arrivals, didn't work. The numbers did not decrease during this time, did not decrease after this time. So as a deterrent effect or an enforcement, it didn't work either. And so you had this period of time where an ineffective policy was put in place ineffectively, and it just failed on all counts, I think.
Cris, I want to bring you in here to talk about what's driving the changes in who's coming to the border. Part of the challenge here, right, is that we have a system that isn't responsive to the kind of people that are showing up at the border today.
Not at all, because if you look at the individuals who are coming to the border, largely it's been families fleeing violence in Central America. We just put out a blog post looking at apprehension numbers, and if you look at the number of family unit apprehensions, those are individuals traveling with families that are detained by CBP, the percentage of that grew from about 3.1% in 2012 or 2013 to now 25% this past year. And so when you're looking at that, this is really important, because our immigration system for the last 20 years has been largely designed to deter and deal with young single Mexican men, or sometimes men from Central America, who are looking for work in the U.S., not for families fleeing violence. And so when you're looking at these people who are coming here and the reasons they're coming here, how, as an immigration system and how as a country, are we going to respond to this? And I think this report really shows that the system has not been designed to be able to address this change in the migrant flows coming to the U.S. From Central America.
One of the key steps that the government has taken after this summer's happenings on the border is an effort to figure out a way to detain families together longer. Theresa, will that solve the problem?
I don't think it will solve the problem. I guess it depends on what you mean by solve, right?
Sure.
From the government's perspective, again, their hope of detaining families is one, to ensure they show up for their immigration hearings, although families who are released with on conditions that, like, for example, reporting into ICE, reporting with community organizations or with ankle braces, are showing up to the hearings for the most part. But more so, I think the government sees the detention as a deterrent of future migrants coming. And that's a capacity issue. They don't have capacity for unaccompanied children. They also don't have capacity to hold families. And they're having a difficult time finding more capacity. That's the whole issue of the Flores settlement that we have talked about previously. They want to be able to detain families longer. They're not allowed to under current law or the settlement agreement, but they don't have the facilities to do it either. And so you could implement that policy, but I don't think the administration would be ready to do so. And you'd have the similar kinds of problems that we're seeing now with detention facilities that exist for just single adults, where they're expanding capacity, but they don't have the oversight to ensure that these facilities are humane.
Yeah. The OIG also released another report concurrently with this one about the conditions in the facility in Southern California. And basically what they found is the conditions were, for lack of a better word, abysmal. And that's an existing facility that's being run by an ICE contractor, and it's been around for a couple of years. If you're then trying to expand capacity, what are the guarantees that the new facilities won't be replicating the problems of the existing ones as well? So that's a key question moving forward.
Yeah. And I would just add that, again, we see no evidence really that for a population that is primarily seeking protection, they're asking for asylum, that the normal sorts of deterrents are going to be significantly effective.
Just ahead, will the government house immigrant children in its custody in a so-called tent city? So let's turn now to a developing story. Various media outlets are reporting in recent days that authorities have been moving immigrant children in federal custody to a so-called tent city that's popped up along the Texas-Mexico border near a town called Tornillo, Texas. Cris, what's driving authorities to do this?
So the individuals, according to media reports, who are being moved to this tent city are largely teenagers whose either their sponsors have not been able to pick them up because of concerns that the sponsors who may be undocumented will be arrested by ICE, or that HHS, that oversees the detention of children, they've been doing fingerprinting of the sponsors who may pick up the children and might detect some issues about the background of these sponsors, issues about criminality, issues about whether or not they would be able to provide them with a safe place to live. So this has largely contributed to an expansion of the number of children who are in detention across the United States. And so, according to the reports, these children are being moved there to be put there because, simply put, the capacity just doesn't exist to hold them in government custody.
So do we know how many children are going to be housed in this facility?
We don't really have any clear idea of the numbers. The reports indicated it might have been a lot.
It may have been 2,300 to 3,000, but it's unclear how many are there now and how long they're going to be there.
Well, that's the other question. Is this intended to be a temporary facility, or is there an intent to keep people here longer?
It's intended to be temporary, and as Cris mentioned, the checks on potential sponsors are taking longer. That's one of the reasons why overall children are remaining in HHS custody longer and longer. And that's one of the reasons why their facilities are at capacity and they're looking for these alternatives. Supposedly, these children may be close to being released, and so the hope is that there would not be at that facility very long. But as Cris mentioned, the new checks that they're doing, particularly the background checks, which were meant to protect the children from being placed in a circumstance where maybe the sponsor has a domestic violence charge against them, or to be put into trafficking or other sorts of situations. We don't want to see that, but that adds to the burden and the length of time. And then this new thing that seems to be happening where ICE is looking at the immigration status of the sponsors and possibly arresting them, that's just keeping people from coming forward. So this is, combined with the number of kids continuing to come to the southwest border unaccompanied, is creating capacity problems for HHS. Again, they were never resourced to deal with this many children. Up until about 2014, they were dealing with maybe a couple of hundred a year, maybe. And now we're talking tens of thousands that they have to deal with.
What's the reaction so far among immigration advocates, and what, if anything, has the government said in response?
I mean, as expected, the advocates have been very critical.
Sure.
They've lambasted this whole plan, and they've largely seen it as another effort by the administration to keep trying to hold children in long-term detention and sort of being able to support its broader goals of trying to have infinite detention of migrant children. And obviously, whether that's the case or not, that's the assumption that's always been happening.
The administration has responded again, just saying this is a capacity issue. We're doing what we have to do in the short term. Congress needs to give us resources to do more, change the law. Congress, there has been at least one effort in Congress, a bipartisan group of members of Congress from Florida have proposed a bill that would tell HHS that they don't have to do fingerprints in every case, and prohibiting ICE from arresting potential sponsors. That may help that particular issue of the flow. But again, I think all of these things, going back to the OIG report, the tent city, we are seeing an immigration system at our U.S.-Mexico border that is in crisis because it is dealing with a migration that it did not expect, was not built for, and trying to retrofit it to and use our enforcement levers as the sole measure of trying to deal with this is just not working.
I mean, this is what happens when you lurch from crisis to crisis, and this is the outcome that you can expect. There's an old saying, you plan to fail, fail to plan to fail. And that, I think, really summarizes the U.S. immigration system and the way it's managed this crisis.
So I suppose I can anticipate your answer to this question, but against this backdrop, what kind of impact do you see this story having on public perception about how the government is handling the detention of immigrant children?
What the American people want, and obviously our survey, we've done a survey with Once Global, which we've discussed in this podcast, is they want to see a system that's well managed, that works. And I think this just gives the impression, once again, that it's broken, it's antiquated, it's out of control, is, one of the descriptors that we heard when describing the system. And this just reinforces that perspective. It gives them the perspective that nothing's being managed. And it's not to say that Americans don't feel sympathy for these children, but they also want something to be effective and managed well.
Yeah. And
this just gives it more fuel to the fire to think that the system isn't working.
Yeah, and I'd also just say that to the extent that the impact here is on children, that's sort of, I think, for a lot of Americans, a place where the failures of the government, even if they really believe in strict immigration enforcement, the impact on kids is one that more and more of the American public are just feeling very uncomfortable with and want to see a different solution.
Okay. Up next, efforts to punish immigrants who use public benefits. About 10 days ago now, the Trump administration released its proposed rule to redefine the criteria for when an immigrant can become a so-called public charge. And this proposal would allow DHS officials to reject people who intend to immigrate to the U.S. permanently or apply for a green card. Theresa, we've been waiting a while to see the final version of this proposal, although we've seen several leaked drafts along the way. Now, we've heard that there was an extensive interagency review process that this rule went through, and there were some dramatic changes. So walk me through what's changed from the early versions we saw to what was released about a week ago.
So this version that was released, I think the major changes that I would say are enumerating the exact benefits that will be considered in the consideration of public charge. So we always knew that public cash benefits, now including Supplemental Nutritional Assistance Program or SNAP, traditional cash-based benefits like temporary assistance to needy families, welfare, general assistance are included, but also use of Medicaid, also use of, for example, housing vouchers, Section 8 housing vouchers or subsidized housing, supplemental health insurance premium subsidies, all of those can be considered. So we now know the exact list of public benefits that can be considered under this public charge rule. The other thing that was made clear is that use by U.S. citizen children in the household in and of itself is not disqualifying. However, and this is where it gets really kind of fuzzy, all of these are pieces of something called a totality of the circumstances standard. So what this means is that the use of these benefits will trigger an evaluation of the overall public charge, but they are to be considered in the totality of the circumstances of that immigrant. So they would look at things like their age, their work history, their medical and health history, how big is their family, and other things in a circumstance to estimate whether or not they're ever likely to need such public assistance again in the future if they're not using it now. And in that situation, even though use of any of these benefits by a child family member is not in and of itself disqualifying, in that totality of the circumstances test, it might be. A couple of other things that we've learned is that they will look back 36 months from the time an immigrant is looking to apply for status, someone's looking to apply for immigrant status. It's applying to people in the United States who are adjusting to a permanent resident status. It will also apply to non-immigrants in the United States, so visitors, students, workers, others who are in the United States and looking to extend or change their non-immigrant status. So this will also apply to them. And of course, to people overseas looking to come into the United States. That's the group. It also, though, will not count any benefits received before the rule is made final. So that's important to note that people who are receiving benefits right now, the rule may not become final for another year or so, and we can talk about the process here, but that's another important thing that we learned.
Do we have a sense of the ways in which this proposal might impact legal immigration? And we spend a lot of time on this podcast talking about illegal immigration, but here we're talking about impacts on legal immigrants.
The main impact on legal immigrants is just to make it harder to meet this public charge standard. So currently, the way the government looks at public charge is, are you likely to be majority dependent on government assistance? This new standard is much lower than that. It doesn't look for a majority of public assistance. It looks for even a minority of public assistance. In one report by David Beer, the Cato Institute, he estimates that families who are 95% self-sufficient might still be considered a public charge under this rule, even if they use eligible benefits they're eligible for a short period of time. So what that generally means is that immigrants who come to the United States with lesser means, maybe with lower education levels and lower skills, with larger families, who cannot document adequately other sources of support, will have a hard time meeting this public charge rule. And that could affect an awful lot of future legal immigrants to the United States.
Yeah, one of the interesting little tidbits about this proposed rule is also immigrants and attending immigrants have to prove a negative.
Yeah.
It says that you have to show that you did not receive public benefits. And so as a result, how will that work out in practice? I mean, if you think about it, that would mean you would literally have to go through every local, state, and federal public benefits agency to fully demonstrate that you did not use public benefits. And so that little tidbit, I think, is also really important because essentially that means you have to document your whole history, and that will implicate every single, you could implicate every single individual.
The other thing I would say is this totality of the circumstances test, again, when they're looking at all of these criteria, age, health, education level, language level, skill level, family history, the way that those factors are ranked and rated is almost like a point system. It's not specifically, there aren't specific points given to any of them, but the fact that those are the factors to be looked at and the way that the rule describes the looking at them, a consular officer, an immigration adjudicator is basically going to say, looking at all of these factors on this individual, frankly, those who have higher education, higher incomes, higher skill levels, and smaller families, and maybe come with a lot of wealth are going to have an easy time, and anyone who doesn't meet that is going to have a little harder time coming in.
Politico has reported that the Justice Department will release a similar rule allowing for the deportation of people who already have status in the U.S. when they become public charges under this new definition. What do we know about that proposal and the impact that it might have?
Right. So we should do a little bit of Immigration Law 101 here.
Yep.
So the USCIS rule relates to something called admissibility. Admissibility is the criteria to enter the United States or gain a new status. So it's in addition to whether or not you qualify for the type of visa you're looking for, there are these other grounds under which you can be deemed inadmissible. And a lot of them are, have you been a criminal? Are you a terrorist? Do you have a communicable health disease? And public charge is one of those grounds of inadmissibility. So it applies to people who are looking to come to the United States or have been here in one status and are looking to get a different one, such as getting a green card. Deportability grounds are for people who already have status in the United States and they commit some sort of violation that the government says, whoops, now you're no longer in status and we can remove you from the United States. The public charge grounds for deportability apply primarily to those who have green cards. Within the first 5 years of receiving a green card under current law, you're not eligible to receive means-tested public federal benefits. So if someone is found to have done that, they can be deported. The other one that's sort of a bigger catch-all is that you can be deported if you're found to have been inadmissible when we let you in. This is where it gets tricky. So if the Department of Justice believes after you've gotten your green card that, whoops, USCIS made a mistake and you actually were a public charge at the time you got your green card, guess what? Now we can remove you. This is a look back. And that's where it gets very tricky for a lot of immigrants. Because if the Department of Justice says, for example, you're using benefits and you promised that you wouldn't become a public charge and it's been 8 years and now here you are, does that mean you were inadmissible at the beginning? It's going to be very difficult. We haven't seen this draft yet. We don't know what it's going to look like. But this could be a real catch-22 for us.
Some state laws extend benefits to non-citizens. And Cris, you've been tweeting about the tensions that this proposal exposes between state and federal law and the potential peril for some legal immigrants that might live in more generous states. Can you explain what you mean?
Yeah, this is where, once again, this rule is going to be implicating a lot of individuals who are living in the United States and may have actually don't realize that they may have become public charges by accessing state benefits. So stepping back, states like California have expanded a whole host of public benefits, both assistance-based as well as Medicaid, to non-citizens with varying degrees of legal status. A state like California has been more generous in extending some of these benefits to undocumented immigrants, and other states like Oregon and Washington have expanded these benefits for non-citizens, and generally so they can access these benefits. The issue with the public charge rule is that it states that both federal but state and local monetizable benefits and state and local non-monetizable benefits that include Medicare. And so when a USCIS officer is going to be adjudicating somebody who already lives in the United States and they want just status to get a green card, one of the things they'll be looking at is the access to these state benefits. So if you're living in a state that's very generous and you've been using these benefits because you thought to yourself, hey, guess what? I can get free access to healthcare, or there's additional benefits I can get, you're going to be you could be potentially in a lot of trouble and have difficulty trying to adjust status. And I think the bigger picture is that what the public charge rule has done is sort of, I'll put it in my own terms, has weaponized these laws. Because essentially, it makes these laws now liabilities for immigrants who've been using them for several years, who thought they wouldn't be in trouble. But now you're seeing these laws now becoming a liability for the individuals who are living in the United States and living in these states. So that's where I think this implication is particularly interesting, because a lot of these states have been doing this because they want to expand the rights for immigrants, and advocates have been saying this is one of the strategies for us to make life a little bit better for immigrants in the United States. Yet this public charge rule shows one thing. When it comes to immigration policy, D.C. is the one who largely controls everything, and whatever D.C. decides to do, whether a state's going to be generous or not generous, is ultimately Washington's decision.
Theresa, you mentioned earlier the process that lies ahead for actually getting to implementation of this rule. What are the challenges that the administration faces over the next months and maybe up to a year?
Sure. So this has been an unusual rule in a lot of ways. The first is that we've seen at least 3 different leaked versions of this. So a rule that gets leaked that many times, significant rule like this, clearly was going through a long process inside government. The rule was released. An unofficial version of the rule was actually released by the Department of Homeland Security before it was published in the Federal Register. Now, for federal rulemaking, the Federal Register is the publication of record. Once it is published in the Federal Register, then it becomes official. So it's highly unusual for an agency to release a rule before it's published in the Federal Register. As a matter of fact, as of the date of this recording, it still has not been published in the Federal Register. We're not entirely sure why, but it hasn't been published yet. So that's step one, is it has to be published. Once it is published, is something called a notice of proposed rulemaking. That means it's not in effect. It is the government proposing to change the rule in these ways. And the public, anybody, has 60 days to issue comments on this rule. And they can comment on any part of the rule. They can comment on the changes to the rule and how it would affect them. They can comment on whether or not the government has done a good enough job analyzing the economic outcomes of the rule. They can comment on whether or not the government has correctly estimated how much time it will take the public to fill out the paperwork for this rule. Every facet of the rule is subject to comment. Once the comment period closes, then the government is required by law to review every single one of those comments, and in this case, it could be in the thousands, and respond to them when they create a final rule. Now, there's no timeline between the closing of the comment period and a final rule publication. The government can take as long as it wants. But when it finally gets to the point of being ready to publish a final rule, they have to address all those comments. Addressing the comments doesn't necessarily mean changing the rule to accommodate the comments. It just means they have to respond and say, we heard you say this is why or not we're changing the rule. Once the rule is in final, then it will be implemented. It will become policy across the U.S. government. There are already a lot of advocacy groups who are looking to challenge this rule in court on one ground or another, but technically they cannot challenge it until it becomes final. So our best guess is that sometime next year is when the government will try to make this rule final. At that point, you will probably see a bunch of litigation and people asking the court to put an injunction against it going into place.
BPC's public polling suggests that the American public and immigration advocates probably differ in how they might see this proposal. Our poll, for example, found that many Americans are deeply concerned that immigrants are accessing public benefits, as they put it, before citizens. Let's set aside the potential problems with that viewpoint. My larger question is what that finding suggests about how Americans might respond to this proposal.
If our polling is anywhere near accurate, probably a lot of Americans will get just the top line view of this proposed rule and say, oh, Sure, we should enforce this rule that says that immigrants should not become a public charge. After all, it's been part of our immigration law for 150 years. Why wouldn't we enforce that? So I think on that level, the public is likely to be supportive. Where we might see some potential problems is, as Cris indicated, in those states that have expanded access to these benefits for immigrants in their state. If immigrants start to pull back from receiving those benefits because they're afraid for their immigration status, that could have follow-on impacts on the rest of their community. For example, if they're no longer getting health care for their children in school and the children have communicable diseases, that affects the entirety of the public health community, for example. If immigrant families are no longer relying on benefits, the proposed rule itself indicates there could be negative health outcomes, particularly for pregnant women and children. It could increase malnutrition among families that aren't accessing, for example, SNAP benefits. So these can have follow-on community benefits. If people aren't having access to primary care, health care, that means they're going to end up in the emergency room when their symptoms are very, very much worse, and that is much more expensive. And that's when the localities and the counties and who runs the public hospitals have to pick up the tab. So at the end of the day, there will probably be other community impacts of this beyond just whether or not the immigrant is, quote unquote, a public charge.
And then there's always the question of employers. Obviously employers who are in the tech industry, for instance, who have non-citizens who are working for them, this won't be an issue. But the question, of course, is employers in quote unquote low skill, industries, whether it's agriculture, whether it's poultry processing or elder care, how this might impact the capacity to be able to keep their workforces if these individuals trying to switch status, for instance. That's something that's going to remain to be seen, whether employers are going to be supportive of this rule, agnostic, or antagonistic. I think that's something to keep in mind as well.
Okay, Cris, Theresa, thanks for joining me. That's all for this week. Thanks to you all for listening, and a special thanks also to our producer, Emily Schrader. Please take a second to find us on Facebook by searching Bipartisan Policy Center, or on Twitter at BPC_bipartisan. And don't forget to subscribe and leave your feedback on this podcast on Apple Podcasts, Google Play, Stitcher, or wherever you get your podcasts. Just search Bipartisan Policy Center. Join us again next time on This Week in Immigration.